Hello, and welcome to the Public Health Shift audio edition. I'm Nadia Tekkal. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 23, AI in Public Health: Why Governance Matters More Than Capability. Today, we are reflecting on something that's gaining more and more traction in public health conversations: AI. Not only in the sense of what it might become or what it could eventually do, but also in terms of how it is already impacting our work. Because the conversation often focuses on readiness. Are systems ready? Are institutions ready? Are regulations keeping pace? While those are important questions, they sometimes pull our attention away from something more immediate, which is that AI is already shaping the way we work, and in many cases, this happens quietly. It might be through a model that informs a projection, a tool that helps synthesize evidence, or a system that supports prioritization. So while we don't always experience AI's influence directly, it often appears somewhere along the chain. And when that happens, AI's influence becomes embedded in the process, which makes it harder to see and even harder to question. So the issue is not only whether we are ready to adopt these tools, but it's whether we are paying attention to how they are already influencing our decisions, and whether those decisions are as explicit as we think they are. Because in practice, they often aren't. What sits behind an output? What assumptions were made? What trade offs are embedded in the model or the way it was used? These are not always visible and they are not always discussed, but they do shape what we end up acting on. This is where governance comes in, not as a separate layer or something that follows innovation, but as something that needs to be present within the process. Because if influence is already there, then governance cannot come later. In many settings, what we see instead is a kind of implicit reliance where outputs are used because they are available, because they save time, and because they appear robust. But the conditions under which they are used and the responsibility attached to them are not clearly defined. So the question becomes one of clarity. Who is responsible for the decisions informed by these tools? What level of scrutiny is being applied to their outputs? And how are uncertainties communicated, especially when decisions need to be made quickly? These are not easy questions to answer, but they don't necessarily require complex solutions either. In many cases, they start with making things just a little bit more explicit. For example, being clearer about where AI supported outputs are entering the process, or by taking a moment to surface and examine assumptions before acting on them, or simply by naming who is accountable for the final decision. These are all small shifts, but they can alter how decisions are made and make it easier to engage with AI tools in a way that is more intentional. So, as the conversation around AI continues to evolve, it may be worth pausing on this. Not only to ask whether systems are ready, but also to look more closely at what is already happening beneath the surface. And the following questions can help in doing so. Where in your work are AI supported outputs already influencing decisions, even if that's done indirectly? When you use these outputs, how clear are their limitations and underlying assumptions? Who is accountable for decisions informed by these tools in your context? And what is one small step you could take to make accountability more explicit? Thank you for listening. If you would like to continue the reflection, you can read the full version of this issue by subscribing to the Public Health Shift newsletter on www.nadiatekkal.com. Until next time, take care and keep questioning how we show up in our work.